Welcome to this presentation on the GIZ position on water, sanitation, hygiene at scale, in short, access to wash services at scale. The following presentation aims at providing you an overview of the objective and concept of GIZ position papers on the one hand, on the WASH status quo and global and regional trends on access to water and sanitation. And then thirdly, and that's the core of this presentation, the position of GIZ and the recommendations for GIZ programs and their partners. And last but not least, we will briefly explain what scaling up readiness assessments are. Firstly, the objective and concept of GIZ position papers are to summarize the point of view of GIZ for important, sometimes also controversial topics, and the positions of GIZ to be applied in all GIZ water and sanitation programs. Secondly, they should inform, orientate, and advise colleagues, both working at headquarters as well as colleagues working in operations on a bilateral or regional or global level. And thirdly, these position papers are intended to be used as a basis, as an orientation for project evaluation and project planning. And currently, apart from this position papers, other position papers are in the process of being developed and also approved by the management team of the division responsible for infrastructure at headquarters. When it comes to WASH, globally, we have a situation whereby 3 billion people or even more is estimated to use contaminated drinking water sources for access to sanitation. It looks even worse. More than 2.5 billion people do not have access to adequate sanitation. This figure is probably even higher for people without access to sanitation services which are sustainable, whereby the whole sanitation chain is actually covered. On the other hand, the Sustainable Development Goals, also the human rights to water and sanitation, which were endorsed by and confirmed by the United Nations in 2010, have a really high ambition level, aiming at universal and sustainable access until the year 2030. The SDG guiding principle of leaving no one behind calls at the same time for an accelerated improvement of the situation for marginalized population groups, and especially in urban areas, which are subject to high growth rates, high rural-urban migration rates. An accelerated provision of access is even more urgent. Lastly, also given the current political circumstances and the humanitarian crisis faced in many parts of the world, especially in the Middle East, but also parts of sub-Saharan Africa, basic to public services is also part of the structural causes of refugee movements and migration, and adequate provision of services is a challenge for host communities. Looking at the SDG target and the reality in least developed countries and also sub-Saharan Africa, we see that the limited progress or even stagnation and decline in coverage in those countries between the baseline year of the MDG and the MDG assessment in 2015 shows that a business as usual approach will not lead to reaching the universal access targets defined in the SDG in 2030. Rather, it is obvious that an accelerated provision of access at scale is needed. Looking into countries where GIZ and the German Development Corporation has been present now for a long time, where they advised utilities, ministries on sector reforms for more than a decade, it becomes obvious that in countries like Burkina Faso, the sector institutions were able to actually provide additional access at a rate which exceeded demand growth in urban low-income areas. On the other hand, we have countries such as Zambia or Tanzania, where access falls massively or moderately behind demand growth. On the other hand, a third category of countries, there we see that the additional access approaches demand growth, but still the access gap is growing. And especially in countries where we have a situation of an increasing or persistent access gap, we need the scale up of access to sanitation services and drinking water. What is the GIZ position now about? It's basically structured around 6 modules, which were derived from evaluations, also from long-term conceptual development work and several assessments done in partner countries. And basically these 6 modules stipulate that on the one hand you need adequate access solutions for water supply and sanitation for low-income areas, and that you need specific instruments, institutional mechanisms to manage information, to manage financing, and to set the framework for the accelerated provision of services. And in the following slides, we will go a bit more into detail what is meant by that. What are the barriers for scaling up access to WASH? When it comes to financing, we observe that low-cost WASH access solutions for the so-called last mile in marginalized areas are usually not focused sufficiently in larger investment programs. Investment programs, either funded through the government or by ODA, are focusing usually on conventional first-mile infrastructure. That means larger treatment plants, network-based sewage or drinking water services coupled with household connections, for example, to sewers or also to drinking water. And one of the results is that investment costs per capita are usually high and do not allow to provide access to all people or at a rate which outstrips demand growth, and they do not fulfill pro-poor requirements. That means they are not affordable for poor households, or low-income areas can, for technical reasons, not be reached through such systems. Sanitation is perceived as a responsibility of households. On the other hand, plot owners or landlords are frequently not willing or able to invest in sanitation. Water quality, especially when it comes to outlets such as yard taps, water kiosks, prepaid stand posts, and others, but also on the household level that's observed. Water quality deteriorates frequently between the point of source, tap, and the point of consumption, which is a result of the necessary transport and storage of drinking water during supply interruptions or when access is not provided in the kitchen of the household itself. On the level of access monitoring, we have observed that in many countries the data quality in existing sector information systems is insufficient, that coverage is frequently overestimated. On the level of water service providers, usually utilities in the urban context, we see that they tend to focus on connected high and middle income areas and do not have the necessary responsibilities and capacities to deliver pro-poor services. And at the same time, informal service providers fill the service gap, but they cannot be regulated. And usually they do not comply with human rights standards and criteria such as the affordability or accessibility of services. Lastly, on the level of policymaking, legal and regulation, we see that marginalized population groups are not really considered in decision makers. No specific provisions frequently also in regulation instruments to consider the needs of poor customer groups. Coming from these barriers, the following recommendations are stipulated in the GIZ position paper. When it comes to the access solutions, one of the key recommendations is that for project measures, be it technical cooperation, but usually we talk also about projects of development partners, need to reach a significant share of underserved people with improved access. And that means also coming from the diagnosis stated earlier, that coverage increases as an outcome must outstrip demand growth. The figure of 500,000 people per project duration, which should be reached, is more or less an indication of what is needed in many country contexts. Secondly, project planning and evaluation should be based on scaling up readiness and opportunity assessments. We'll come back to that later. And we need the close collaboration with German and other financial cooperation agencies, especially when it comes to linking technical implementation concepts, pro-poor implementation concepts, with the required financial support to roll them out. Pro-poor implementation concepts go beyond what is usually contained in strategies or policies, but it goes into very much into the technical, operational details of how decentralized on-site sanitation services can be organized and promoted, and how low-cost water supply outlets should be designed and operated in order to guarantee water supply for low-income areas. And implementation concepts thereby not only stipulate technical standards, but also provide the business models, the social marketing instruments, and also management concepts to deliver these services sustainably. And wherever possible, water, sanitation, hygiene need to be integrated and addressed simultaneously. When it comes to financing, GIZ programs should advise partners to establish the required financing strategies and mechanisms, focused and explicitly mandated to invest in decentralized last-mile infrastructure and low-cost access solutions. They have to comply with good governance norms, of course. For example, they might need, in addition to the pro-poor mandate, autonomy and funding mechanisms, funding procedures, allowing for a certain competition for good quality of investment proposals, and also results orientation in order to ensure that the number of beneficiaries is maximized. It should be supported in mobilizing investments, either from development partners, but also through approaches such as sanitation levies on the water bill, for example. GIZ programs should strive to introduce mechanisms for accountability for the impact of investments, and these financing institutions should provide also the required technical support to the implementing organizations when executing last-mile projects. When it comes to access information systems, GIZ programs should develop and institutionalize national access monitoring systems, providing realistic and verifiable coverage data. Coverage data must be accessible for all low-income areas, not only for a project area, and they should serve as a basis also for donors, for the government, for investment planning, technology choice, and reporting. Global monitoring, thereby done by the Joint Monitoring Program, should also use these national systems as they are usually more up-to-date or can be more accurate than household surveys. GIZ programs should, in order to reach this, scrutinize existing data and existing reporting systems. Where necessary, baseline studies, countrywide baseline studies should be conducted to provide a realistic picture of the access situation. And wherever possible, national databases in partner institutions, be it regulators, service providers, or financing institutions, should be utilized and further improved in order to improve sector monitoring and reporting. On the level of water and sanitation service providers, they should be enabled and supported either directly through utility strengthening support or via the regulatory system and the political framework to include social obligations in their mandates and sort of force them to serve low-income areas. In order to do that, utilities need dedicated strategies and proper units to gradually formalize service provision in low-income areas, and that also requires to have a clear internal responsibility, also a business model to deliver on-site sanitation services, fecal sludge management services, and drinking water supply services through outlets such as water kiosks or prepaid stand posts. Promote the mandate for on-site sanitation. This is currently in many countries still a gap and a service covered by municipalities who are, however, usually not in the position to raise the necessary funding and who do not have the technical capacity to do so, such as utilities. When it comes to the policy and institutional framework, GIZ programs should support the design of the policy and legal framework in a way that the human rights to water and sanitation and expansion of wash services in low-income areas get the right attention. These topics should be brought into the sector dialogue. They need also measurable, quantifiable indicators and targets, because otherwise the risk is high that they remain statements on paper. A strategy is needed how to outphase informal service provision. In some circumstances, cooperation with education and the health sector might be necessary, and especially when it comes to on-site sanitation to decentralized sanitation services, the legal basis, first of all, has to be developed for the sector. And in the same wake, the regulatory instruments which exist in many countries already, such as tariff guidelines, service standards, etc., should be adapted and further developed in a way that they promote the coverage increase and also the engagement of underserved people, also provide mechanisms to give them a voice in making regulatory decisions and setting tariffs, for example. Based on these recommendations, the scaling up readiness assessments are an instrument offered by the water section, which has been applied in 4 countries up to now, which allows to analyze the current situation in the sector along these 6 modules based on certain key guiding questions, and to provide recommendations to the GIZ program, but also to the sector and the partners, on how to advance the pro-poor agenda in the sector and how to bring the sector in alignment with the SDG and also with the human right to water and sanitation. And these key questions, for example, for the financing mechanisms, the question whether there are transparent criteria for funding allocation, whether external audits are conducted to verify the impact of investments. These key questions are answered in a summary report and can also be fed into a stakeholder process with partners. If you have any further questions on the scaling up readiness assessment or on the positions of GIZ on scaling up access to water and sanitation, do not hesitate to contact me, Daniel Nordman, at the water section, or also contribute to the wiki Wash at Scale, which is also accessible to all GIZ advisors, but also to consultants and partners of GIZ. Thank you very much for your attention. I'm looking forward to getting in touch with you. Thank you very much.